Hello, everyone. Today, our group will be presenting a community-based health promotion plan focused on colon cancer prevention in Taiwan. Colon cancer is the second most common cancer in the country, and despite access to free screening programs, the uptake remains relatively low. Our presentation outlines a culturally adapted education strategy aimed at improving awareness, increasing screening participation, and ultimately saving lives. We'll walk you through the public health problem, our target population, needs assessment, and the framework guiding our intervention. According to the most recent Taiwan Cancer Registry data, colorectal cancer has been the most common type of cancer for the last 14 years, with a new case diagnosed every 30 minutes. To address the public health problem that is colorectal cancer in Taiwan, we have developed an education and prevention plan. First, here are some facts about colon cancer in Taiwan. Colon cancer is the second most common cancer in Taiwan. Mortality rate is high due to late diagnoses despite government screening programs. The importance of increasing screening and early detection in Taiwan will be talked about in this presentation. This presentation proposes a community-based, culturally adapted education plan. According to Taiwan's Ministry of Health and Welfare in 2023, colorectal cancer accounts for over 6,000 deaths annually. Although a national screening program exists, it's underutilized. Many individuals delay screening until symptoms appear, when treatment is less effective. Common barriers include fear of cancer, a general lack of awareness about the benefits of early detection, and the cultural taboo of discussing bowel health. This highlights the urgent need for a new approach that resonates with the public and addresses these specific barriers. Our primary target population is Taiwanese adults aged 50 to 75, particularly those living in rural or underserved areas. This group faces limited access to healthcare services and often has lower levels of formal education, which may contribute to misunderstanding or mistrust of preventative measures. Reaching this demographic is critical because they are the ones most eligible for free screening, yet they're the least likely to participate. Our program will emphasize working through community networks, including religious and local leaders, to build trust and engagement.
As for the needs assessment of our targeted population group, the first need that we may need to address is that many older adults in Taiwan do not understand the purpose of preventative screenings. So in order to address this potential need, we would focus on providing education to this specific age group about the significance, importance, and benefits of having preventative screenings. One of these benefits being potentially diagnosing cancer at an earlier stage as opposed to a more aggressive later stage cancer. The next need we would address is the cultural belief that often leads people to seek care only when symptoms appear. Once again, going back to my previous point, just providing education regarding the need to recognize these potential issues before symptoms actually occur is the goal. And hopefully allows us to diagnose cancer at an earlier stage. Lastly, we will also educate each one of our patients and address their health literacy, so understand what they perceive about colorectal cancer and colorectal cancer screenings. By understanding what their prior knowledge is of these topics, we are able to better tailor our care to our patients. Next, for our theoretical framework, we chose to use the health belief model for our education plan. So for our perceived susceptibility, we want to highlight that the risk for individuals for colorectal cancer is over the age of 50. For our perceived severity, we will share testimonials from colon cancer survivors. For perceived benefits, we will emphasize early detection and how this is commonly associated with better outcomes. For our cues to action, we plan on using text reminders, family events, and provider recommendations. For our goals and our objectives, our goal is to improve knowledge and participation in colon cancer screening among older adults in Taiwan. Our first objective is by the end of the pilot to increase screening intent by 30%, as well as deliver culturally tailored education sessions to 300 participants over 3 months. For our intervention strategies, our first strategy is to host community education sessions at temples, community centers, and clinics. Secondly, we'd like to distribute traditional Chinese language pamphlets with infographics. Next, we would like to train local elders as peer educators to deliver sessions. And lastly, we would like to offer on-site fecal occult blood test kits at events, as well as instructions on how to do these tests at home. Lastly, for our implementation plan, by month 1, we would like to recruit educators, develop materials, as well as schedule venues. Then around months 2 to 3, we would like to pilot in rural areas, such as the Hualien and Chiayi regions. And hopefully by month 4, we will be able to provide follow-up evaluation and adjustment for scale-up.
Hello, my name is Amy Galindo, and I will be presenting slides 11 through 16. The evaluation plan. The intent of the evaluation plan is to gauge the progress in meeting screening goals and objectives. This can be assessed by obtaining pre- and post-surveys on colorectal cancer knowledge and screening intent, by tracking fecal occult blood tests, and by conducting brief, standardized, objective follow-up calls for qualitative feedback. In creating and implementing our plan, consideration for budget and resources must be factored in. When providing educational resources to increase colorectal screening knowledge and awareness, factors related to budgeting and resource demands must be considered. These include the cost of event supplies, the cost of printing and/or creating electronic materials, and the cost of staffing educators. Anticipated barriers to increasing colorectal cancer awareness and screening include cultural taboos in talking about colorectal health and distrust in new programs. Suggested solutions to mitigate these challenges include the use of indirect messaging and/or storytelling, and partnering with trusted local leaders and/or faith-based groups. Lastly, calling the plan to action would address the idea that while Taiwan has a strong infrastructure, it could further benefit from using culturally rooted education to promote knowledge and awareness. Also, implementing a plan that empowers the community and normalizes screening, and a plan that ultimately saves lives. The Taiwan Group thanks you for your time.